So here we go, continuing pivoting, wrapping up this 2020, going into 2021, headstrong right here. We always like to keep it relevant to what we're seeing right in front of us in practice. What we have right here is another lab report, a results finding from another toxic metal test we did. And if you look at this puppy right here, you see we have this line going all the way across there, another off-the-chart mercury finding in somebody. Now we've done some work before, there were reasons that we suspected this. Talked it over with the patient, so we ran the test. You never know when heavy metals from various sources could be a driver. Through these tests, what we've discovered sometimes in people is things elevated like cadmium, gadolinium from contrasting agents, lead. But one of the most pervasive ones is the mercury. And mercury can be found from a variety of sources. What we found to be seemingly the most prevalent source has been those amalgams that people have in their mouth, the ones that they said were silver, but they're 50% mercury. Now, over time, as we've discussed in the past, these can slowly corrode over time, Minimal levels, but you digest that. You digest that down. They're also off-gassing slowly in your mouth over time, especially if they become more corroded or damaged, and you're inhaling that. So that's two sources of the mercury going down. Your body can process this to a little bit. Ideally, it should if everything is up to par, nutritional status, liver status, everything like that. But it becomes an issue when it's just constant, and that's what this is. It's like a constant slow leak, and if you imagine all of the other toxins we're exposed to all of the time, this can lead to an inability or inhibition, subpar ability to take that mercury that's flowing in and process it. So now we start to see accumulation of that due to the bombardment of the other toxins that we live around. So that mercury can accumulate at that point. Mercury can be very pervasive, and it can cause a lot of different signs and symptoms. This is Doctor's Data is the lab that we like to use for this with patients, and this is straight off their lab report too, and it does correlate with all the findings we've seen before. Early signs of some excessive exposure can be a decrease in senses of touch, hearing, vision, taste, metallic taste in the mouth, fatigue, lack of physical endurance, and even increased salivation. They may progress, and this is what we see more often in people. This is with the chronic exposure. Chronic exposure, we start to see things like the neurological symptoms, the numbness, the tingling. Can't explain that, but they have a neuropathy or a paresthesia. They're not sure why they have it in their limbs. Mercury could be driving tinnitus, ringing in the ears, things like that. Headaches, hypertension, irritability, excitability, even immune suppression and dysregulation, which we all have concerns about nowadays, and justifiably so. So mercury is one to think about, and if it makes sense, it wants to test for. When we test this right here, there's about 20 different metals that we test for, mercury being one of them. We check it out. If it is in there, there is more than one way to get in there, mobilize that mercury, and look to detox it safely. If it is coming primarily from the amalgams in your mouth, ultimately you want to get rid of the source as well, but you want to get rid of that bioaccumulation in your body tissue as well, and take it from there. So again, we like to bring you what's really happening in this office, what we're seeing day to day with people, and the avenues that are available for help. So keep your eyes open, stay positive, make the changes, start investigating. You do a test like this, nothing's elevated, cool, rule it out, move on to the next one. There's other things that can be investigated. You find it, correct it, move on, optimize health, live better, stronger, confident, happy.